Knee swelling is a double-edged sword. On one side, it's completely normal and actually necessary for healing to occur, but on the other side, it can completely stall progress if it's lingering longer than it should. So will your knee be swollen for the first 2 or so months after surgery? Of course, but it needs to be properly and frequently measured to make sure that it's actually decreasing appropriately over time. Many of my clients reach out to me months after ACL or knee surgery because their progress has stalled, and they often have lingering pain, stiffness, and weakness. What do I usually find? Their knee is still a bit swollen. In this video, I'm going to show you 2 ways to properly measure knee swelling, and I'll share specific actionable steps that you can do today to reduce your swelling. Let's first cover why lingering swelling can be problematic. After injury or surgery, joint swelling contributes to a neurological process called arthrogenic muscle inhibition. Basically, in a nutshell, this disrupts the natural signaling between your brain and the affected joint and surrounding muscles. You probably noticed this when you tried to contract your quadriceps muscle after surgery or injury, and it just felt disconnected, like someone pulled the electrical cord out of the wall outlet. So, as long as swelling is hanging around, there is going to be some level of muscle inhibition or disconnection that we can call it going on, especially with the quadriceps. And this can cause a nasty cascade if it's not addressed. Think of our muscles as natural shock absorbers for our joints, right? While this is an oversimplification, it will illustrate the point I'm about to make. So, if the main shock absorber, the quadriceps muscles, aren't working optimally, there will be more stress and loading placed on the knee joint itself with walking and daily tasks like stairs, squatting, so on and so forth, possibly leading to more swelling, and more swelling will lead to worse quadriceps function. Swelling levels also go hand in hand with knee range of motion. So picture this. Picture your knee joint as a water balloon. A healthy knee is like an empty water balloon with nothing in it, right? You can grab the sides of that water balloon, you can stretch it pretty far in all directions, right? But when the water balloon fills up with water, we can't really stretch it as much as we used to because the fluid has taken up most of the slack. Similarly, if our knee is swollen, getting back those last few degrees of motion will be very difficult. And last but not least, swelling often coincides with pain. Excessive swelling can amplify your pain levels, leading to additional quadriceps muscle inhibition. Now, to be clear, swelling is completely normal early on. Swelling is part of the healing process, and it is necessary for this to actually occur. The key is swelling needs to be tapering off over time. It needs to be monitored and it needs to be measured. And it should ideally be gone 3 or so months after surgery. Now, this timeline will vary based on person to person, the exact surgical procedures that they had, as well as personal lifestyle factors, but it's a good rule of thumb. So there's 2 simple ways to measure swelling appropriately. The first way is by doing a circumferential measurement. Now for this, you can use a tape measure or tailor tape if you haven't. Otherwise, you can use a piece of string and a ruler or a measuring tape like I will show you here. The key here is that you need to be consistent with where you are taking your measurement. The simplest way is to do a mid-patellar measurement, meaning you will be measuring around the middle of your kneecap. With your knee straight out and relaxed, first find your kneecap or your patella. Once we found the top and bottom borders, take one end of the measuring tape and hold it right in the center. Now, wrap it directly around the back of your knee until you meet the beginning of the tape in front. This will give you the circumferential measurement. If you don't have a measuring tape like this, repeat the same process using a piece of string. As you wrap the string around the front of your knee, grab exactly where the end of the string met the front of the string with your fingers. Lay this out against the ruler to get your circumferential measurement. This can be done before exercising and immediately after. A good rule of thumb is that we don't want swelling to be increasing more than 2 centimeters or 3/4 of an inch from baseline. If your swelling increased more than this is your knee's way of saying it wasn't too happy with what you were doing. The second way to measure swelling is something called the sweep test. This is usually performed by a trained medical professional. First, you swipe up on the inside aspect of the knee a few times in an attempt to push out any fluid from the knee joint, and then you watch to see if there's any spontaneous fluid return to the inside part of the knee. If there's not any spontaneous return, perform a downstroke on the outside aspect of the knee and watch the inner part of the joint. Based on fluid return, you can grade swelling from there using this scale. So how do we manage swelling? The first component is measuring it properly and often to make sure that the activities that you're doing are agreeing with your knee. Without measurements, we are purely guessing if things are improving. Second, we need to make sure that you are hitting important milestones in your recovery and that you're following a proper rehab program. Getting off crutches before you have good quality quad control and before you achieve full extension range of motion is a very common example of trying to progress to activities before your knee is actually ready for it, and it will likely result in increased or lingering swelling. Working with an ACL and knee specialist is important to make sure you're doing activities that your knee is actually ready for, not just activities that you want your knee to be ready for. If you want a full breakdown on the 5 important milestones to hit within the first 3 months of your recovery, check out the video description for the link. Now, less important, but still useful, are compression, elevation, and icing. These often have a temporary effect on swelling, but they can be useful to manage it when done consistently early on or during a flare-up. However, no amount of compression, elevation, icing, red light, massage, or any fancy treatment for that matter is going to make up for poor programming. And there you have it. If you found this useful, please like, comment, and subscribe for more knee and ACL rehab tips. If you're tired of spinning your wheels with your knee recovery, or maybe you're early on in this process and you really want to just do it right the first time, book a free call using the link in the video description, and let's find out what the bottleneck is in your recovery. I'll see you on the next video.